Hi, I am Dr. Delia Large-Hart from Columbia Pike Animal Hospital and Town and Country, and we are talking today about dog eye care issues. Some of the signs that we see for eye infections are going to be discharge from the eyes. If the discharge is just a clear discharge that they've always had, that might just be what we call epiphora. And so it's basically just some discharge that's not actually infectious. The infectious ones are more green or yellow colors. We can also sometimes see where they are blinking quite a bit, and that can indicate a little bit of pain as well with that. Not all infections seem painful, but a lot of times that they will be scratching at their eyes, and that will make it painful. And so we're looking at what color is the discharge that's coming out, and then also do we have any signs that that's painful as well. There are 3 different bacteria that are the primary ones that we see in cats and dogs. That's going to be staph, strep, and Pseudomonas. That's in like 99.9% of the eyes. That's the infections you're going to get. So when we are treating those animals, we're treating them with a couple different types of medications that will help those 3 bacteria to be taken care of. And so we don't usually culture those. We actually just treat them because it's usually those 3. However, it is a possibility to culture them if we need to, or if they continue to come back. Some of the most common issues that we see are going to be infection. Also, any sort of corneal abrasion, meaning there's a laceration to the eye, there's a rub on the eye, there's an ulcer there. All of those things are basically what we're going to see most of the time. We do see some of the more scarier things too, which would be that we actually have an eye that's trying to come out, or proptos, and those are a little bit scarier, but also things that are a lot of times treatable as well. For me, the things that I think are emergency eye issues for dogs are all eye issues for dogs. So anytime anything is going on with the eye, I believe it's an emergency. And that is because the eye is so sensitive. I think they need to come in no matter what you're seeing. So if you are seeing a scratch, you're seeing infection, you're seeing something really scary like proptosis or the eye coming out, any of those things that you see are going to be scary because they can all lead to more. And we want to hit something really early in the beginning so that we don't have something that's very scary in the end. So there are different eye issues that are more at risk for each type of breed. So when we have things like the brachycephalic breeds or those short nose breeds, we have things like dry eye a lot of times because the eyes push out a little bit more. And so you have that ability to get more dry eye, which means you have more of an ability to get ulcers. But then you have other dogs that have a disease called pannus, and that's something that we look at for certain breeds. And then you have other animals that might have lens luxation. And so, like for instance, a Jack Russell is more likely to get a lens luxation because of a gene type that they have. So every breed has something that could be more likely. And when they come in, oh, this breed is coming in, this is likely, but you don't go straight to that because you want to make sure that you're evaluating that specific dog as a whole. So I'm really careful about, yes, I know that this is probably what this dog is going to be, but I don't want to just jump straight to that when they come in, or you might miss, the forest for the tree. There are some tests that we can do for vision here in the clinic. We will be looking at a menace response. So we're actually coming towards the animal with our hand, seeing how they respond to it. If they're not responding to that, we're going to do what's called the PLRs, which is your pupillary light reflex. So we want to see when we put a light in, does that eye come down and constrict, or when we go away, does it dilate? Does the other eye respond to it? Because that tells me what the optic nerve is doing as well. So we have a couple of different tests that we do. That's going to tell us, are we visual? Or do we have a dazzle, meaning do we respond to light at all? And so those are some of the kind of smaller testing. As far as can we test for, do we have 20/20 vision like a human? No, we don't do that here. There are tests to do that at the ophthalmologist, but usually we're not doing that unless we're doing something more breed specific for like a breeding program, or if there's someone that's actually doing lens work. But usually we're just wondering, hey, is this dog visual or is this cat visual? And the reason we care about that is our dog doesn't need to read the newspaper, right? But they do need to be able to navigate around their house. Eye injuries are treated in a lot of different ways depending on what it is. So if it's an ulcer, I am extremely aggressive on any eye problem. I'm extremely aggressive. It depends on which veterinarian you go to, how conservative they are, how aggressive they are. Dealing with the ophthalmologist that I've gotten to shadow, I have some amazing people that I've gotten to go and work under. They have really, the ones that I've seen be really successful have been extremely aggressive. So I want to get in there with any antibiotics that are needed at the time, any anti-inflammatories. Do we need serum that's coming straight from the animal in order to be able to get that healing process back a little faster? If it's something like the eye is coming out, I need to push it back in immediately, try and assess if it's still visual, close it up so that it has time to heal and stay back in that globe, and then we do follow-ups and lots of follow-ups. So it just depends on kind of what's going on. And if it's terrible, if it's something that can't be fixed, yes, then that's when we go to thinking about a nucleation. But I'm really conservative on going straight to a nucleation because there's a lot of times we can fix these things. Anytime an eyeball is involved, I think a specialist is a great idea. However, I understand that the specialist schedules are very full and it's hard to get into the specialist and you might not be able to, to get to that place. And financially, it can be kind of tough to go into the specialist. So, the specialist absolutely needs to do your phacoemulsifications, which is your cataract surgeries. They are absolutely going to be the ones that are going to do the hardcore surgeries. They're the ones that are going to do the things that can't be fixed in clinic when we've tried and they're still not getting better. So I think coming to your local vet and getting in and being seen, one, sometimes it's an emergency, we need to do it right then. I think that's a great idea. Come in, get evaluated, and then we can decide when we can get you to the ophthalmologist. But I am never gonna say that we're gonna do better than the ophthalmologist is, because they're always gonna be your best resort for that. And so I love to be careful in saying they're gonna be the best because they've done a lot of it. But there are a lot of things that we can do ahead of that, especially just even to prepare you for going to that ophthalmologist. And a lot of times we can treat things and they'll be totally fine and you won't have to go. So there's quite a bit of things that you can do for your eye care at home. One of my favorite eye washes is Bausch & Lomb eye wash solution that you can get from the grocery store. It's nice, it's been proven to be useful for dogs and does not seem to bother them at all. It's the one that I always suggest. So if your dog goes out and does something like runs through the field and gets some grass seeds in the eyes, or likes to rub, their head on the ground and gets dirt in the eyes, washing those out when they come back in is a great idea. If you're ever going to be out, with your animal out in the woods, out in the fields, anything like that, when they come back in, just wash it out, just rinse it out. But being really careful not to go in and rub anything, because you don't want to rub something against it. But just doing the flush is going to be really helpful for them. So that's probably my favorite thing. Besides that, I want you to come in if you need help with anything. One of the main things that I do want to make sure to mention is that cat and dog medicines, some of them are the exact same, some of them we use cross species, but some of them we do not. So there's Neopolybac and Neopolydex are two of the drugs that we use for dogs that we should not use for cats, because there have been way too many times where they've shown anaphylactic shock. And so we need to be really careful, and if you have medicine at home for one animal make sure that it is appropriate for the other animal. Don't just be giving things at home just based on my dog had an ulcer, now my cat has an ulcer. You can't cross that. There are quite a few that will be the same, but just being really super careful that we don't mix up the species. Thank you guys for watching today. We would love to have you come in for eye exams and then also for any of your eye emergencies so that we can get you on the other side of it and get your pet feeling better as fast as possible.